Hey, Krause here with another crazy Dr. Krause segment, this time on some of the basics you need when you start anatomy and physiology. And these come right out of the first four chapters. Are super simple, and then we'll be into cell biology and what else? Histology, and then the skin. Anyway, you need some basics if you're going to understand anatomy and physiology, if you're going to retain any of it, and if you're going to be able to apply it later on in other coursework. So later on academically, later on in a healthcare profession or a healthcare career. Uh, One of the basics are the keys to learning. First edition has 7. Earlier segment in Crazy Dr. Krause has 9. Second edition of Super Simple, which comes out in August of 2020. It's going to be absolutely beautiful. Everybody's talking about it. August of 2020, second edition will have 10 keys to learning. Things like repetition, emotions, either good or bad, vocalization, talk about things, read out loud. Even if you're by yourself, read out loud, read to somebody else, explain things to somebody else. Even a household pet or your 3-year-old nephew that you're babysitting for or whatever. Vocalize, visualization, which is easily applicable to anatomy, but also can be helpful in physiology. And there's some flow charts in Super Simple that help you visualize physiological processes like cellular respiration, the production of energy, or protein synthesis, the manufacturing of proteins by the cells. And then we've got concepts, things like form follows function. Things in the human body are shaped, structured the way they're structured because of what they do. The function determines the anatomy. The physiology determines the anatomy. So the anatomy will reveal something about the physiology because the physiology, the function, created the structure. Things are structured the way they're structured because of what they do. FFF, really big concept. Another underlying concept with Super Simple and in any learning environment is the ones doing the most work are the ones doing the most learning. So put yourselves in situations where you have to struggle. Teach to learn. That's a great way to really deepen your understanding. Try to get somebody else to understand a concept. And then communicate and collaborate, 2 other C's. Communicate, collaborate, work together, help each other, and you'll get a better outcome for all involved. Associating existing knowledge with new knowledge. We'll do that with the cardiovascular system and in other places in Super Simple. Then movement, evolving research that shows that when the human body physically moves, the brain works better. So walk, talk, pair, walk and talk. Walk with a study buddy and talk about something rather than sitting down. Movement creates better learning. And finally, memorization. And there are lots of memorization techniques. I'm big on minimizing memorization, but there's memorization in learning anything, a foreign language, playing the piano, hitting a golf ball, whatever it is. There's some anatomy and physiology. There's certainly some memorization involved. So understand the keys to learning. Form follows function. The H2O sheet, there's a previous Crazy Dr. Krause, KDK segment about the H2O sheet. Really good visualization. Human organism and homeostasis, 2 H's and an O on a single sheet with a little pathophysiology thrown in the last column. That would be column 5. And POS, physiology on a single sheet. Those are both really useful conceptual visualizations that can be helpful to you. And then the basics, like organizational hierarchy, and that's a part of the H2O sheet. Human body is organized by taking little small things, subatomic particles, protons, positively charged, neutrons, neutral, that's why they're called neutrons, hello, and electrons, negatively charged. Just those three things in a variety of combination make up atoms, make up molecules, make up biochemicals, macromolecules like CPLN, carbohydrates, proteins, lipids, nucleic acids, DNA, and RNA. Macromolecules, biochemicals form intracellular organelles like endoplasmic reticulum, mitochondria, which creates energy. Cells, the basic structural and functional unit of the human body. Cells get together to make tissues. Four primary tissues in the human body: ECMN, epithelium, connective, muscle, and lipid or fat. Uh, the lipid or fat. No, take that back. I went backwards. ECMN, the four primary tissues: epithelium, connective, muscle, and nervous tissue. Nervous tissue eyes back to the four biochemicals: CPLN, carbs, proteins, lipids, those are fats, nucleic acids. Four biochemicals, four primary tissues in the human body: ECMN, epithelium, connective, muscle, and nervous tissue. Epithelium covers and lines, covers things, lines things. Connective tissue connects, supports, that's why it's called connective. Muscle creates movement. Nervous is all about communication in the human body. So organizational hierarchy, tissue level, then tissues get together, those four primary tissues to form organs, organs group together to form organ systems like the respiratory, cardiovascular, digestive system, and all those systems grouped together form the human organism. Let's see, what else? All of the basic nomenclature in anatomy and physiology. A and P definitions. What is anatomy? Study of human structure. What is physiology? Study of human form. Anatomical terminology, terms like anterior, posterior, inferior, superior. You need to review and know those terms. Regions, body regions, including the 9 abdominal regions: left and right, hypochondriac, epigastric, umbilical, hypogastric. 4 quadrants: left and right, upper quadrants, left and right, lower quadrants. Anatomical planes: sagittal, mid-sagittal, parasagittal, transverse, frontal, coronal. Need to know all those. Body cavities: open and closed body cavities, and all the subdivisions of the closed body cavities. Open body cavities are those body cavities that you can stick a finger in. Those are open to the outside environment. They're lined by mucous membranes that provide a part of innate immunity. Whereas closed body cavities, you can't easily stick a finger in, not with a lot of effort and a lot of pain anyway. They're lined by serous membranes that produce a thin, watery serous fluid that lubricates so our internal organs can function easily and appropriately. So know your body cavities, open and closed. Know all your anatomical regions. There are a bunch of them, and here there's some significant amount of memorization with repetition. Repetition, big part of memorization. Memorization always, I would say, involves repetition, at least to some degree. So know your body regions like axilla, popliteal, femoral, brachial, antebrachial. Anatomical position. We have a standard position that we refer to the human body as being in. Whenever we're talking about it, whether it's an anatomical model, whether it's a patient, they are always referred to as if they were in the anatomical position, which is, you gotta back it up, You got to stand erect, feet about shoulder widths apart, toes pointing forward, upper extremities at your sides with the palms anterior. So the thumbs are lateral and the little finger is medial. And we always refer to the human body or to parts of the human body as being in that position, anatomical position. Really, really important. Homeostasis, another concept, dynamic constancy, the body, it's like a sine wave in math. The body is able to maintain a relatively constant internal environment within an upper and lower limits, although it always fluctuates, whether it's body temperature, blood glucose levels, blood calcium levels. So that's a bunch of stuff, but if you don't know that stuff, it's going to make it virtually impossible for you to be successful as you proceed in learning anatomy and physiology. So know the basics. Until next time, Krause out.